is great. That through the partners from UK, the mothers of Masanda, of Bukasakya sub-county in general, can access very good services, and especially in maternal health, because initially we've been only having deliveries, and where somebody fails to deliver, they've been always referred to the referral hospital, either in the maternal or in the main hospital. But now that we have a theatre which is fully operational, the theatre has been there for some time, but it wasn't equipped. And now 2 months ago it was equipped, and all the equipment that is required for a cesarean or any other surgery is available here. And this is very good for the mothers, especially for those who have difficulties in giving birth to their children. And therefore, it's such a big milestone, because if mothers had no transport to go to the referral hospital, many of them end up dying on the roads. But now that they're able to be worked on here, and the first cesarean took place yesterday, and we're excited about that. And the mother is well. I've just been with her. She's well. She's able to walk and exercise, and her baby is also doing well. That is in this facility is the staffing. Currently, they have about 45 staff, of whom only 14 have been paid by government. Therefore, we are appealing to government and work together to see that at least there's more recruitment that takes place in this facility. And then, at least if the recruitment takes place, these people are going to be catered for. Let government pay the staff, because the partners have really built the infrastructure. And the first infrastructure would have been complete, but it is not, because the money is diverted to pay the staff who are there. So we really thank our partners so much. They've done a great job for the last 8 years. They've been 7 years or so. They've been paying the staff, and this makes them not be able to complete the other infrastructure. So government, we are appealing that we work together and we see that we have staff in this place, because it is going to help a great deal. In fact, it's already helping now that the theatre is operational. Now, if that mother, if the theatre was not there, we don't know what would have happened to that mother. And right now we pray that the doctor, we have only one doctor so far, and if she is assisted by maybe other 2 doctors or 1 more, I think they will move much more. And if we get also an anesthetist, we don't have an anesthetist here, and this will make it to help a great deal. And therefore, also the other thing is to make sure that, because this place has a theatre, it's almost a fully fledged hospital, and we pray that government lifts it to that center for status, so that it will match with the staff that will be required. Because as long as it is higher, the staff will definitely be recruited by government.
Yes.
I'm so humbled by the Rees and the other partners. Many times, when people are blessed with resources, we normally think about ourselves. I hope I'm right. But getting out of your country, you even board a plane and get to some village and look at people and have sympathy of people you've never known, of people you've never even had any attachment with. It takes God. And no wonder God is blessing you. And thank you for even finding other partners, that this facility would be a white elephant if it did not have the equipment. Now you went ahead and said, no, these are high-ranking people, but I can still speak to them. They can even come and visit the facility. You lobbied for us, the black people. Oh my God. May God richly bless you. People come to this nation to invest. And when you invest, you get profit. But you're not getting any profit. And you are continuing to invest in us just because you love us. May God love you for us. That He continues to provide and that the skies will be the limit. And to our people in Masanda, mwanyala kutambisa lidwaliro. Because if the facility is there and nobody comes, it will be again another challenge. But they've honored this facility and said, no, we will not go to the big one in town. But they chose to come to their own, which is even nearer to them. You don't know what you've done to our people. You've eased so much. Because walking to town was another burden. And then also, thank you, walking to town is another burden. And then while they are there, they get hungry and they have no food. But you've solved each and every problem for our people here. That they just walk here, get services, and get back home and do other things. So whoever is using this facility, you are even blessing it. And you are also getting blessed. We are appreciating the services of these health workers. We are appreciating the donation, the partnering of our dear partners, the Rees family and the others. Spotlight, the board, and all the people connected with all the doctors. Thank you so much. And I was surprised that all the doctors who came here have known what happened here yesterday. I like the network. Thank you so much for networking. Because everybody was giving that testimony, meaning they are working in harmony. Dr. Mugonyi, thank you so much for the networking. That you involve other doctors. You even tell them of the progress of other facilities. And that's how they are going to all come and work together with others. That we work together and make sure that the human resource required here is all available. Because together we can. And thank God you've promised. But let's get the critical ones and make sure that they are here. And I also pledge that we will work together. When I get to Parliament, I also bring a motion, maybe a matter of national importance or urgent importance, that our facility in Masanda be elevated to a health center 4. And if it's elevated, surely, when it is elevated, then government will fully come in and make sure that the recruitment is done. Because you are out of 40-something staff, only 14 are being paid by government. That is too meager, though we are grateful that at least we are somewhere. So we need to make sure that at least this facility, the human resource, now surely people have built for us the facility. Again, they are paying the staff. When we are watching, they go away with all the blessing. For sure, let's partner. Government, Madam Commissioner, let this get to our top officials and they get to know that when we have been given a gift of the infrastructure, let's also work on the other nitty-gritties to make sure that our people have at least better lives. Many other places government has constructed and then they also equip and also recruit. But here, the burden is lessened. It is lessened. That we need just to triple the effort that we give all the medical staff, all the staff that is required here. I want to thank you for keeping this place clean.
It will take us a long way. We also have platforms to discuss health issues. And I want to thank the representative from Regional Hospital. We have local maternity and neonatal system. We are so grateful. Your work at this level informs us of what gaps and at times, many times we are able to fix them as soon as possible. And let's carry on with that. We have what we call maternal. Now we have put a platform where we discuss what could have gone wrong, such that such things doesn't repeat itself. I will encourage the city officials, thank you, the CHO, but also the town clerk and mayor, at times be part of that, so that there are few things which you can learn, and together we can be able to fix. Because we are the other side, you are this side, you are the monitors, and you are the ones to feed us with some of those gaps which are there. We are happy that this place is fully equipped, and facility in charge has said it. What I will add is that can we take care? Can we become accountable for this equipment? Can we use all the skills which we have to maintain them, so that we maintain them, we use them nicely, we make accountability, and they will serve the people accordingly. I'm happy RCC has ably said that in this facility there is no absenteeism. That has been our biggest problem as Minister of Health. Our biggest problem, because we cannot monitor these health workers. So please, all the leadership from the city, from the LOCs, and the board members, and so on, and can you make the use? Honorable, I'm happy you all been coming here, and through my vision with God, you will come back the next 5 years to make this place as your sitting room, so that you are able to really keep this what it is. All absenteeism. When you go on the little roster, it's covered from day, evening, and night, but they are not available. So let's be available. Not present, but available. And so that we are able to serve our people very, very well. We have upgraded all these facilities. We have really talked to the government, and government gave us mandate to review our structure and put health force which we think can manage these different levels. We did that work very successful. As we speak now, we have a new structure which is approved by public service. But our only issue is wage. So, Honorable, as you prepare to go back, please, can you sit with the others? If it means jumping on the table, can you do that, so that we get wage from government to be able to recruit and increase this 45 to be about 60 on government payroll? We have done our part. Now the remaining part is for you people who are sitting on the other side, because this has brought a lot of issues. There's a lot of workload, we understand, but we are saying amidst the workload, you should be available. When you come on duty, if you are in antenatal and at the same time you are in maternity, make a priority. Because a mother who is still pregnant, who when you ask is not sick, can come back another day. But somebody who has come in a labor, you cannot send her home. So make priority. As I said earlier, I'm a nurse and a midwife. I worked in the facility for 18 years before I went to Ministry of Health. And I worked in maternity for 10 years, continuously, before I worked as a nurse, 8 years in other areas. So you can make priority, but make sure we protect our mothers, we respect them, we really give them that honor to appreciate and also love our facilities, because these facilities are for them. When they don't come, when we don't respect them, when they come from maternity, when we don't give them that right to really know that they have right to come, right to ask what services, they will cease and they will remain at home. And when they remain at home, they will become also account for the statistics of those who go on the other side of morbidity or mortality, which we don't want to see. And
why that was the vision that was given to us to build that maternity centre, because of that friend of mine who lost his 2 daughters in Lesotho. And so I spent about 3 years raising the money to build this maternity centre in England. And I got architects who helped from London and from New York, and they gave their services for free. And they designed this fantastic maternity centre. And with our construction committee, we met every 2 weeks for a period of 2.5 years. And we so carefully constructed this with love, brick by brick, to serve the community of Masanda and the surrounding areas. And so it has been a great privilege to get to this stage of this journey, where we heard with great delight yesterday we've had the first cesarean section. So thank you, Doctor, for that wonderful service. That as donors in the UK, we can't take on all of the operating costs of such a place as this, which is why we need to work closely in partnership with the Ministry of Health in Kampala and obviously the City Health Office in Mbale. So we ask you as leaders in healthcare for the whole of Uganda to come together, to work together to find a budget that will suit this place, that will enable this place to continue to grow. Because our ambition is to deliver 3,000 babies every year safely. And we have the capacity to do that. So with your friendship and partnership, we'll work together to deliver. Thank you.